Hi everyone, how are we doing? So today let's talk about all-on-4 treatments. It's something which we've covered a lot on this channel, and let me talk you through 6 things which I think a lot of people don't expect when they're starting to go down this journey. So my name's Gus, I'm a cosmetic and implant dentist based in the UK, and we do a lot of all-on-4 treatments. All-on-4 treatment is essentially a treatment for those people whose teeth are in such a bad condition that we have to remove everything, put implants in, and give a solid set of teeth, and we do it all in one day. Okay, that's most of the appeal of this treatment, is that all the problems are solved in one day. The reality isn't that simple, but most of the treatment is done in one session. Okay, and this video is all about what happens in that session and the following weeks after that session. Now, on the day of treatment, there is a whole load of stuff which needs to happen, okay, and it takes time. So typically, if I'm doing a case and we've just got, say, just the top teeth, we'll start at 9 o'clock and usually be finishing off about 1 o'clock, something like that. But we often book a little bit longer because sometimes we can have unexpected things happen. We can need to change our game plan and things drag out a little bit longer. If we're doing top and bottom in the same day, we usually finish about between 3 and 4 o'clock. Now, the thing to bear in mind here is that especially if you're having sedation to calm your nerves down during this treatment, the advice is not to eat the night before. So you have this period of fasting before treatment and you can't eat during the appointment. Okay, so you're gonna be hungry. It's a long day, and some of my patients have been a bit grumpy afterwards, and it's been because they haven't eaten, which is reasonable. I get a bit grumpy when I haven't eaten as well. Now, to compound this, you're not doing a lot. Okay, now a couple of times a year I will actually do a deliberate fast for health reasons, and it's difficult to do. But what makes it a lot easier is concentrating on other things, trying to distract yourself. But if you're in the dental chair and you're having this stuff done, there's nothing to distract you. So it can be quite a difficult day, in terms of the length of the day. And weirdly, if you're just sitting there having this treatment done, it's really tiring as well. Okay, so just be prepared for this. Don't think it's a walk in the park mentally, okay, because mentally it can be quite draining. Now, once the treatment is said and done, you're going to leave with a set of temporary teeth. These temporary teeth are really there to hold and connect all of the implants together. Okay, and that's how this treatment works. That's the secret sauce. All the implants are stuck together so we can give you teeth which you can kind of chew on straight away. And one thing that a lot of people comment on is the thickness of these things. Okay, from the outside they look very nice, but from the inside there's a lump of plastic there. And that lump of plastic is going to be there for the next 3 to 6 months, depending on how quickly your dentist will go and put the final teeth on. Now, the reason it's there is the temporaries are made from plastic, and plastic gets all of its strength from thickness. It's not going to be like this for the final set of teeth, because typically the final set have either a metal skeleton or they're just made from a different material, for example, zirconia, and that material can be a lot thinner. Now, the thickness of the temporaries is going to cause an issue with speaking. Okay, a lot of people will be lisping and they'll just find this plastic thing quite annoying. Now, it's not quite as annoying as having a denture which covers the roof of your mouth, but still, you're going through a lot of treatment. It's very expensive, and some people might see this as a bit of a drawback. It is a drawback, but it's a limitation of that phase of treatment, okay, and the materials used in that phase of treatment. Now, a lot of these points that I'm going to talk about are related to the temporaries. Okay, we've spoken about the feeling of the temporaries. The next thing to bear in mind is the look of the temporaries. Quite often when people come and see us, the look of their teeth is really not very good. And if you look at all of the before and afters, the before and afters are fantastic. This is a dramatic improvement. But don't expect that perfect smile on the temporaries. We've put temporaries in for our patients and the midline has been off to one side. Some of the teeth are longer on one side than they are on the other. Sometimes the smile is more full on one side than the other. Okay, all of these things can happen. We do aim for absolute perfection on the temporaries because it makes our job a lot easier as we move forward to make the actual final restorations. But because we are almost guessing on what the smile should look like, sometimes the teeth can be long, they can be short, they can be off to the side. All of these minor things can happen in the temporaries. Point number 4 is to do with the strength of the temporaries. A minute ago, I told you that the temporaries get their strength from the thickness of the material. Even with this thickness, we can still get problems with teeth pinging off the temporaries. Again, this is, I'm going to say, moderately common. I'd say maybe 10% of the cases that we do have this, but it's far more common if we have implants in the lower jaw as well. Okay, so implants against implants, top and bottom. And the reason is your implants don't have any kind of sensors to tell you how hard you're biting. If you had just implants at the top and natural teeth at the bottom, your bottom teeth have these sensors and it can tell if you're biting too hard. Now, if you've got implants against implants, just randomly a tooth can chip off. It can be when you're eating something really soft. It can happen in the middle of the night when people kind of grind their teeth together, okay? And more often than not, it's a front tooth that breaks, okay? When this happens, it is distressful and we want to just sort the problem out as quickly as possible. Now, if this happens, it's usually an easy-ish fix, okay? Unless your temporaries are broken like this, which is a much more complicated fix. But a single tooth here and there can effectively be glued back on. Not with super glue, we use proper stuff, which is dentally safe. But in essence, this is what we are doing. Once a tooth breaks, once a temporary breaks, it is a bit more likely to break again. We're never at 100% strength. So it is a case of just doing a patch-up job until we get to the point where we're doing the final restorations. Now, in cases where people have had quite large breakages in their temporaries, we do have an option to make a new set of temporaries once the final teeth have been made. This gives you the added advantage that if something was to happen with your final teeth, which occasionally it can, you do have a spare set that you can go in for a short period of time while the final ones are being replaced. Point number 5 is how many teeth you get on your all-on-4, whether it's your temporary teeth or your final teeth. This is largely dictated by how far back we can get the furthest implant. Now, if you look at an X-ray on a typical all-on-4, you'll notice that the implants at the back are slanted forward. Now, the reason for this is we have an air sinus, which we want to try and avoid. The air sinus is different sizes in different people. So the amount of bone we have going back stops in different positions for different people. And that's what dictates where the final position of the last tooth can be. I'd say the most common number of teeth to have on a set of all-on-4, a standard all-on-4, is 10 teeth. So that's 5 teeth each side of the midline. Now, some people have really wide smiles, and if we just did 10 teeth, you'd be able to see the gap behind these teeth. Now, for these people, there are other options. There's other types of implants. We can use something called a pterygoid implant, which goes really far back, and that will give a full set of teeth. Now, if we can't put the implant far back enough because of the sinus, we have the option of a zygomatic implant. Now, this is a bit of a specialist implant, and not everybody will do it. Even the pterygoid requires quite advanced implant skills, but a zygomatic implant engages different bone. Okay, so we're not worried about the sinus. It kind of goes past the sinus, it goes next to it, and engages a little bit higher up. So this again is one of those get out of jail cards where if we can't give a decent number of teeth at the front, we have options going back, even for those people who've got large air sinuses and not enough traditional bone where we would put our implants. Point number 6 is related to the final set of teeth, actually. So they may not look exactly like your favorite before and after photo. And the reason for this is that everybody is different. A couple of years ago, we had a lady who had all-on-4 treatment done at the top, and there was a gap between her teeth at the top and bottom. Okay, not a vertical gap, so they were closing, they were overlapping, but it was more of a kind of a horizontal gap. Her top teeth were more forward than her lower teeth. And this is appropriate for those people whose skeletons have this we call it an anterior posterior discrepancy. Okay, some people's jaws are just not aligned top and bottom on top of each other. Okay, in fact, only 70% of people have this pattern. The other 30% have either the top jaw is forward or their bottom jaw is forward, or some kind of variation of those. So if the jaws are not directly on top of each other, the teeth are unlikely to be on top of each other perfectly. Okay, if it's only a small discrepancy, we can camouflage it, but if it's a kind of a larger discrepancy, then the teeth are not going to be perfectly on top of each other. Now, there is a lot that we can do to customize your smile to make it perfect for yourself. Now, it's important to realize that there are limitations on the aesthetics. We will try our best to make the smile look absolutely perfect for you, and we'll listen to you and trying to achieve your goals in terms of the way things look. Okay, in terms of aesthetics, I tend to kind of just take control initially, do what I think looks good, and then we take feedback from our patients. You know, if they think that the teeth are too wide, too small, too long, too short, we listen to that as well. And then together we reach that end result. But sometimes, just due to the nature of implant treatment, some modifications may not be possible, which means you may need to compromise on small things here and there. It's impossible to explain all of your individual possible limitations because there are so many. And this brings me on to point number 7, which is a bonus point, which is just expect the unexpected. I've had patients come in and tell me that because of their all-on-4 treatment, they've started to salivate too much, or they salivate too little, or they get electric shocks from one implant occasionally, or something in that area. Some people tell me they get sensitivity from an implant, which from a biological standpoint is actually impossible. So there is stuff which can happen which nobody is expecting, but usually the consequence of this stuff is an annoyance rather than something which is completely debilitating. So even though the results of this treatment look absolutely fantastic, it looks like natural teeth, the take-home message is here that they are not natural teeth. So we have to understand this and appreciate this. Yes, it's a lot of money. Yes, it's going to take a long time, even though the treatment says teeth in a day. But if you're realistic, if you're going in this with an open mind, if you realize where you came for and all you're expecting is a dramatic improvement, I think you're going to be really, really happy with the end result that you get from this kind of treatment. If you want to find out more about how I do the treatment and the exact process which goes on in the day, I have got a video about this and I'll put it on the screen so you can just link straight to that video now.